What's up, Warriors, and welcome to another episode of the Mental Health Movement Podcast, Voice for the Voiceless. I'm your host, Chris. Before we start with today's episode, I just want to say thank you to all my listeners for the constant support, especially these last couple months. We just hit our 29th country. Within the last week, I've had 3 new countries hit the podcast, so thank you guys again for your support. Today's special guest, he is a trauma-informed specialist, a functional psychiatry specialist, brain health expert, and founder of the White Butterfly Healing Society. Please help me welcome Dr. Hector Rodriguez. Hector, how you doing, my friend?
Hey, how are you doing?
Good, man. Good. Thank you so much for coming on.
Thank you for having me.
Yeah, of course. Like we were talking about before we started recording. Appreciate your flexibility, and super grateful to have this conversation, man.
Well, listen, one of the main reasons why I go on podcasts and I'm really active on social media is because I like how you opened your show, actually, because I think a lot of people in mental health are marginalized and kind of pushed aside, like if they're broken or something like that. And I hate that. So one of the main reasons why I started doing more podcasts and things like that is to start changing that
Right.
one step a bit at a time. So that's one of the main reasons why I'm really passionate about what I'm doing and why I don't care when you tell me when are we gonna film it.
Right. Right.
I'm like, I'm there. Don't worry about it.
Let's talk about the beginning of your journey. And I formed this question in a specific way because I love that you went from photography to where you're at now. So you started out as a photographer, like you mentioned before we started recording. Before you became a psychiatrist, what drew you from capturing light to helping people find their own?
First of all, that was really beautiful. I need to remember that. So it's just I felt that when I was a photographer, I was doing a lot of the stuff that what I'm doing today. What I mean by that is listening, learning people. Why do we do what we do? Being really excited to hear someone's story, right? I did a lot of fashion stuff, commercial things. So usually my photo shoots were the whole day or maybe 2 days of shooting the same person. So one of the things that I got in the habit of doing is when they're doing hair and makeup, I spend the whole time talking to them. So it was something that I was kind of already doing as a photographer. I didn't think that that was even therapeutic for that model that showed up at 7 a.m., but she was partying until 5, right? And she would tell me her whole story and where she was from. And so I was really always very passionate about hearing where people are going, where they're coming from, and why do we do what we do. So that always intrigued me. I was always a someone that paid attention to behavior, so I was always looking at people. And as a photographer at that time, it almost felt like perfect the combination, right? And then now, over the years, I realized that I think I want to make this a profession and learn more. And then that's when I decided to go and pursue medicine again. And I
Yeah.
say again because originally I was going to, and then I fell in love with photography and art. I still do. Um, so for me, it was like a perfect kind of like move into this.
Yeah.
And then now that I am a photographer, I still do a lot of that stuff. And I'm talking about the art. This is just I see it as a different way to express myself. And I told the patient once, now I just take pictures of brains instead of the person,
Right.
um, which is really not much of a change if I think about it.
The I love that you said the listening and learning part more specifically because doing what you're doing now and the photography, you know where you want to put that camera lens and you want to focus on it and wonder why it is shaped the way that it is or whatever you're taking the picture of, and doing what you're doing now, listening to patients and hearing how they're feeling about certain things and why their behavior is the way that they are. I've always found photography is such an interesting career for so many people, and hearing how you transitioned from that to where you're at now, I love that you made the connection there.
It clicked one day.
Yeah.
It literally was one day. I remember the day. We're in this really big campaign. The whole campaign was about a week and a half, and I remember the stylist was just arguing a lot with the assistant photographer that was there. and they were, arguing about a bra strap that was showing or not showing or whatever. And it literally clicked it for me that moment. I'm like, wait a minute. I feel that I need to have more in my life than arguing about a bra strap. So, it went from like me really being passionate about talking to someone to like, wait, what am I doing?
Right.
I could be doing this more of my day and not arguing about a bra strap. So it was literally in that photo shoot, and I can remember I can picture it, that I was like, I'm in the wrong place. You know what I mean? I'm like, this can't be what I'm gonna give back to society.
Right. Right.
And nothing against, the people that do it professionally. I have a lot of friends that do it professionally, and they always, they've always seen me as like the odd one because I was always into different things and never really, they couldn't put me in a box.
Yeah.
We like to put people in boxes, and I never really did that. So it was just a smooth transition, but
Yeah.
there was that day that it clicked.
Yeah. So you had mentioned your friends and just kind of like your surroundings and whatnot. How was your upbringing, your cultural background? How has that shaped the way that you approach mental health?
Well, I'm Cuban.
Hmm.
I was born in Cuba. We came to the States when I was about 9 years old. I think I don't remember. I haven't done my own, and I've been wanting to this year. I realized that I think I need to, is doing my own trauma focused therapies. I've specialized a lot with trauma, whether it's big T trauma, little T trauma. I tend to have a lot of patients that's their history. Um, and I feel that during that transition, there was a lot of things that I saw that I shouldn't have seen as a 9 year old.
Yeah.
I think there must be something there in the back of my mind. And I know because I scan my brain, and my occipital lobe, which is kind of like the part of our brain that stores visual memories, is
Hmm.
really lit up. So I think there is something there. So all that to tell you that I think that also kind of pushed me to be really falling in love with people who've experienced pain, people who've experienced difficult times,
Right.
major stressors. So I think at least that those kind of events, I radiated towards that kind of individual.
Right.
Um, and I think it would be dumb to say that no one has experienced traumatic or stressor events. I think the more we study trauma, the more we understand stressors, the more we start realizing, no, wait a minute, that was a stressful time for me.
Right.
A 6 year old shouldn't have been gone through that.
Right.
Did. You know what I mean? So I think that has definitely done it. And then the other part, I mean, everyone in my family is um, very strong will. They've never taught me to just kind of let things be, or that's too hard, don't do it. On the contrary, they would really push me to do things that were difficult. And I think mental health and being a psychiatrist is one of the most difficult specialties that exist. And I was a chief resident, I would tell that to the students. I'm like, this is the hardest specialty. Our patients are the most difficult. If you can handle this, you got to leave,
Right.
right? So this is not, nothing against my dermatology friends. I'm like, this is not dermatology. This is deep rooted wounds. Someone's soul is in pain, and they might curse you out, and it has to slide right out because that's their brain talking.
Right.
That's their anger, and you have to let them give it to somebody. I'd rather take it and give me than them dump it on a family member that doesn't know how to cope with that. So I would always say that because I learned a lot of that kind of, taking on difficult things from my parents. I saw it as a kid all the time.
Yeah.
So they modeled that in my life, and obviously I'm very thankful for them doing that. I don't think they realized that they did. They did. You know what I
Yeah.
mean?
So essentially, it's kind of like you're putting your little self in their shoes, I guess, and just trying to add to what you went through, and also trying to help them get through what they're going through, essentially, right?
And I
Um,
think once we really understand where someone is suffering from and in pain, I don't have to have experienced it,
right.
but really come to understand the pain, right? And respect it and not just be like, oh, whatever.
Yeah.
So that's one of the things that really I learned from them, and I've been able to.
And I feel like the most important part is that that we're listening, right? Sometimes somebody's going through a really hard time. They don't always need advice and they don't always need a reply from somebody. They just need somebody to, like you said, bounce off of. It's not going to hurt me yelling, just get it off your chest.
No.
And in a world of constant technology and information and communication, sometimes it's so hard to talk to people because you get that unsolicited advice. And I feel like sometimes we're not very good at our own boundaries when it comes to telling people, hey, I just need somebody to listen. I don't want to hear advice. I don't want to hear what I should do better. Like, I just need somebody to listen. And a lot of people don't get that.
I think when it comes to that, sometimes people don't know because they have their own struggles and they don't know how to cope with them. They don't know how to work them through. So then they feel that if you're doing that to me, like meaning telling me all the stuff that you're dealing with, that I have to give you a solution because I don't have a solution for mine. But no, we
Right.
really don't have to. And I like how you mentioned about listening. We hear about active listening, and you should learn how to listen to someone. It takes a lot of brain power to really listen to the other person. Try not to get my brain immediately to be looking for a response. Like, no, just listen. And then give yourself some time to respond if you need to respond.
Right.
You know?
And one thing that I'm estranged from my mom. Her and I don't really have a relationship. And I remember one of the more specific things I told her when we got into an argument. I said, you don't ever listen to like try to understand. You just kind of listen to reply. And that's why we don't have a relationship. And she couldn't seem to process that. So, every time that, somebody's venting to me, unless they ask me, what should I do? I don't tell them what they should do. It's like, oh, well, it might sound like this, or do you feel better? Like, you vented. But yeah, I always felt like people just don't ever really listen to understand. I mean, obviously not generalizing everybody, but I mean, it's a really big
It's a
collection of
big
people.
number of people.
Yeah.
It's a
Yeah.
big number of people. And I think you mentioned something about your mom.
Hmm.
Chances are she has her wounds that she didn't know. No one taught her how to. And she was taught the behavior, right, by just
Right.
watching, that you just jump in and you're supposed to give an answer to your kid,
Hmm.
right? So I've noticed that in some of my parents when I'm working with someone, that I'm like, but wait, hold on, you're doing what was done to you, which I get it, you learned it, so you're just gonna do it again. Try to change that, and sometimes helping them have some awareness that you realize that you're doing that. It's not bad, it's not
Right.
evil. I don't think it's intentional, but it might be just coming from a place of nervousness. And I feel that because I have a wound, and I don't like how that feels, and I notice that you're telling me about your wound,
Right.
that I have to just try to patch yours up.
Exactly.
Like, no, I just want you to hear me, But many relationships, especially with parents, that happens. And I think a lot of our parents were taught to do this, to solve the problems of their child,
Yeah.
right? Their parents did that. But then we fail as a parent, then we fail at allowing the kid to look for the solution. It's like teaching the person how to fish and the person how to
Right.
fish, right? Even if you know the answer, I was actually talking to a patient yesterday about this. Even if you see the answers right there behind him, keep getting them to think, because now you're pushing their brain to look for a solution. Use their creativity.
Hmm.
Then they build their own resilience. You see what I mean?
Right.
So sometimes allowing that time to pass and just literally listen to your
Yeah.
child, not only could help them in your relationship with them, but also allow them to solve
Yeah.
that problem,
Absolutely.
whatever they're coming to you for.
Yeah. I couldn't agree more. Um, You speak often to sacred outcasts and deep feelers. Do you see yourself in that description?
Yes.
So, what exactly would you consider? What is a sacred outcast like?
When I say sacred outcast, I'm talking
Mhm.
about people that, even in their own struggles and their own oddness, um, I think, they've been really chosen to be a light for a lot of people that just do the same thing, right? The followers. and I consider that person sacred.
Yeah.
Those people tend to be leaders. They think differently, right? And because they think differently, they're more likely to lead that group that is just everyone's thinking the same thing.
Mm.
I'm a big believer of creativity in any field that you are working with, using your mind for. And it's those outcasts that because they were outcasted, they've had to think of other creative ways to survive, that they're trained their brain to be creative.
Right.
So they tend to be leaders.
Mm.
So they tend to try to make a movement, make a change. And they're usually a little bit fearless because they've already felt that they've lost most of the stuff,
Right.
right? Friendships, people don't want to deal with it.
Mm-hmm.
I lost that. All right, well, let me focus on this because whatever. And eventually, a lot of those people radiate towards us.
Yeah.
Because they will, right? Now we're lighting up. So to me, an outcast and a sacred outcast is what I try to teach all my patients to be. And I applaud them when they think differently. I applaud them when they challenge systems, when they challenge us as doctors. I tell them, no, ask me questions. That's one other thing I learned from my mom. She would question every single doctor that we came in front of. Whenever I have a mom or a dad questioning my plan, I don't get upset. That's their kid. I want them to question.
Yeah.
Are you sure, doctor, this is good for them? Because I read somewhere, blah, blah, blah. That doesn't insult me. If anything, it gets me to like, oh crap, I have to study more.
Yeah.
I can educate this person, right? Because maybe they have been misinformed. Or maybe, you know what, that is actually pretty good. You know what, you're right. I'm not going to go this direction. I'm going to go in this other direction. So being able to think differently, it also gives us that confidence of you can come at me with anything and I'm not going to feel challenged.
Right.
Because I see it as a positive thing. You're challenging my brain to think outside the box.
Right.
Most outcasts already are already thinkers outside the box. So I actually bring it on. I get excited when I get challenged.
Yeah.
It makes me think different.
And I love that you encourage it because, I feel I had one really bad experience with a therapist. She tried to prescribe me medicine. And, it wasn't like since the day that I was alive or, I was born to now that I've just always been depressed. It was just, I needed somebody to listen and just, talk me through that session. And she immediately went right to antidepressants. I'm like, I don't want to take antidepressants. Like, I don't feel like I need them. And her response was, well, if you had high blood pressure, wouldn't you take medicine for that? I'm like, well, yeah, it's for your health, I guess. And then she just kind of like dismissed how I was feeling about antidepressants. So sorry to veer off track there for a second, but I love that you encourage your patients to ask questions because, like you said, sometimes they could be misinformed. Or this thing that you said really took me for a whirl was maybe I need to go back and study because I didn't know that, or like it's humbling to hear somebody of your stature, of what you do, be willing to learn more if you need to learn more. Because so many people I feel like, are so stuck in their ways of doing things that they don't encourage patients to ask questions, to, wonder why they're taking certain medications and, why your plan is the way that it is. I love more than anything that you encourage that.
I tell my patients when I first meet them, I'm a collaborator. We're here to collaborate together. I'm going to tell you all the tools that I have in my toolbox. I'm going to suggest this one might be better than this other one. But hey, this is your call. And I always tell them, this is your brain, not mine. Right? But if I get a question or I get a patient that is challenging me, for example, on my specific treatment, whether it's a supplement, whether it's a diet change, whether it's whatever, my first thing is like, okay, well, I want to understand more from you. Why are you feeling that way? Most of the time, it's just misinformation. Someone told me blah, blah, blah. I read somewhere, blah, blah, blah. Okay, well, let me clarify that for you. And there's been a few times where I'm like, you know what? Let me get back to you. Because I do want to clarify this thought,
Yeah.
right? That I think is not right, but let me give you the benefit of the doubt because right now I'm not too sure. Let me go look it up and I'll tell you. Next time we meet, discuss it further. When I bring about, and I'm glad you brought this up about medications. When I bring about it, let's try this medication. I like to explain why. Many professionals don't. I don't
Right.
know why. I'm like, dude, people can just go look it up. The mechanism of action of any medication. They can look up all the side effects. So tell them. Chances are you're going to get diarrhea, nausea, blah, blah. But that's probably going to be the first 3 days. Because online, they're not going to put that, right? They're going to say you're going to get this, but maybe not. I like to have my patient be equipped and learn. And I tell them, if you go look up something, because I know you will, I tell them that I know you're going to go look it up. Let's discuss it. But this is what I'm proposing today. I'm not telling you we're going to do it today. I'm just telling you I think this is the direction we should go. But next time we meet, let me know. Most of the time, they tell me, you know what? No, I trust you. Because I explained it to them.
Yeah.
I'm giving them the logic. This is what I'm thinking. I think we should go in this direction because of this, this, and this. Remember how I told you that you should got to eat more carbs? We make serotonin. Your body needs, it's crying for serotonin. So let's change up your diet. We also got to do some 5-HTP because that's a precursor to serotonin. So it's like I'm constantly teaching because I'll be honest with you, there's a lot of crap out there that people are being misinformed.
Oh yeah.
A lot.
Right.
And one of the major reasons why I got so active in social media was to start bringing information that is, first of all, science-based. There's a lot of stuff that is out there that people are recommending that I'm like, there's no evidence for that. You can do it, but most likely that's placebo effect. But I like to educate a lot because I want them to be an educated patient. I don't want you to take it just because I say so. Here, take this because I say so.
Right.
No, I'm explaining to you why. If you have more questions, bring it on and we'll meet again and we can go over those.
Yeah.
You know?
And it's essentially kind of like when I was working on the suicide hotline, and the first thing they told us is build that rapport with the people you're talking to. Get to know their name and see why they're feeling the way that they are. And like you said, you explain to your patients why you're recommending things, and why they're feeling certain ways about certain things, and educating them. I feel that is so almost so lost in this society because, like you said, a lot of professionals don't explain why medications are being prescribed to them. I remember being prescribed something that made me feel horrible, and when I came back, then they said it was something completely different. I'm like, this is why I don't go to the doctors, because it's hard to trust people. Um, but I think it's great that you educate your patients, because I feel that's so important, especially people that say they trust you. I mean, that's huge.
I need to make sure, like I said, my patient's educated. I treat my patients like my family.
Yeah.
So this is my sister. That medication is, what if you get pregnant? The risk for messing up your baby.
Yeah.
Hold on, maybe not. I'm not kidding. Like I literally think like this is my brother, and would I want my brother to maybe have this reaction later, or if I think that they might have it. Now, a lot of the times we don't know these things might happen or not happen. If there's a high likelihood, based on what I know, that you might have a bad reaction to this, man, he wants to feel dizzy,
Right.
Kind of crazy when it comes to that. But sometimes like I'll try a medication to be like, let me see what this really does. I took Lexapro once. I was so dizzy. I'm like, no wonder nobody wants to take this within the same day. And I'm
Yeah.
not against meds. Don't get me wrong.
Yeah.
I'm against the wrong medication for the person. Right? There's over 300 psychiatric medications, and God knows how many thousands of combinations.
Right.
We're all extremely unique. We know that. So, but just the feeling of like dizziness, and it was specifically when I worked out.
Mm-hmm.
Bro does
Oh God, that's even worse.
exercising. I know. I was at the gym and I was like, what the hell is this crap?
Hopefully you weren't on the treadmill.
Well, I tried and I was
Oh
like,
no.
I can't do this. And I remember going to my friend, I'm like, I gotta go. I don't know when this is gonna go away, but I have to stop moving because I know Lexapro when we exercise is more likely
Right.
to cause that dizziness. But just dizziness was so uncomfortable
Right.
that I was like, and sometimes I think of that too. Like, okay, I'm gonna prescribe you this. Would I just take it?
Right.
If I think like that,
Yeah. Yeah.
take it myself, right?
Um,
I gotta think twice.
I remember when I had my very first anxiety attack in the office, the job that I work at, and I had a friend who was prescribed Xanax for her anxiety, and she's like, "Hey, I have some Xanax. If I can break one in half for you, and take that." And I've never taken Xanax before. I will never take it ever again. Oh my god, I felt so weird,
Yeah.
and
And here, listen, and theoretically, for a panic attack, Xanax is actually a good medication.
yeah,
I don't like benzos. I don't like how addictive they can be. I don't like how they can lower our cognitive functions. God knows we don't want dementia. So I don't want to go in that direction. I hardly use those. But if I do, I want something that can stop a panic attack.
yeah,
Also, people think of this like albuterol. An asthmatic is having a panic attack, reach for the albuterol. But we have to try it first.
right.
A low dose. See how
And
you
it
feel.
was a high dosage. That's what's even bad.
Oh my
Yeah, I think she had like a what was it,
God.
500 milligrams or something?
No, it
She
comes in
broke
like
one in half.
0.5, 1 or 2.
Yeah,
Maybe it was 0.5 or
yeah. It was pretty bad.
and not everyone reacts the same too.
Right, right.
So, not to spend too much time on meds, but like I do pharmacogenetic testing.
Hmm.
Many people don't know that that exists.
Right.
You metabolize medications may be very different from me. I have to do that first to then decide which
Yeah.
medication to go into, you know? But, yeah, you would think like Xanax is great for panic attacks because
Hmm.
she tolerate it well. And
Yeah.
I'm sure she took it a lot.
Um, so your work blends neuroscience with spirituality. How do you balance clinical science with your soul work in your sessions?
Well, to me, it's the same thing.
Hmm.
The word psychiatry means the medical treatment of the soul. So that's how I start most of my introductions, right? Hey, I'm a psychiatrist. My job is to work on your soul. People are like, wait, what? That's intense. So I immediately go there. We are trained in psychiatry and in residency to look at, the body, the biopsychosocial, right? Social, the psychological stressors. But the fourth one is the spiritual. Our spiritual, the way we think, the way we plan, hopes, right? All of that comes so hand in hand with what I do, that I can't separate the two.
Right.
And I don't have to believe the same belief system as my patient, but I need to start understanding what is their belief system. How do they view themselves? What hopes do they have for themselves? Right? What are their goals? Just short term, but long term. What one of the biggest questions we all ask is, what is our purpose? Why am I here? So these are important questions that define someone's thinking about themselves and their surroundings. So it speaks a lot with the type of symptoms the person has.
Right.
So I have to go there. So to me, they go hand in hand.
Yeah. I love that you make that just one connection, and an interesting take that psychiatry is working on their soul. I love that you made that connection there too, because I would have never thought of it like that either.
But that's literally the word psyche is
Hmm.
soul, and psychiatry is the medical
Right.
treatment. So that's actually the name why I named my practice the White Butterfly. So Psyche, and it's a statue of Psyche kissing Cupid. So it's this concept of the heart and your soul together.
Which I love that you brought that up. What inspired the creation of the White Butterfly Healing Society, and what does the butterfly symbolize for you?
So it comes from that. I was in Paris right before the pandemic, literally right before everything went on lockdown, like February of 2020.
Hmm.
And there was a statue that really called to me. It was in a corner, and it was a statue of Cupid kissing Psyche, and that's the statue is called Cupid's Kiss. I thought it was really cool and beautiful, and I have pictures of her everywhere. Actually, my desktop is a close up of another statue of Psyche, and she is known as the white butterfly. So to me, it was like a perfect marriage. That Psyche comes from the word psychiatry means soul, and she is the white butterfly. And as we all know, butterflies have a transformational um, concepts, ideas. And recently, I had someone give me this I guess this image, and I loved it even more. And told her, I'm going to steal that from you. That was amazing. And she said how sometimes, people might come in and try to open that caterpillar, right, to help the butterfly, but it actually weakens the butterfly and then eventually it dies faster. So sometimes when we try to help another person or try to solve their problem, we're actually weakening them.
Hmm.
So there's so many connections in how I practice medicine and specifically psychiatry with the white butterfly specifically. So to me, it was like perfect, perfect marriage because it's how I think about people, and it's beautiful to see them. It might sound corny, but it's true. It's beautiful to see them kind of like be a butterfly
Yeah.
because then you're like, crap, look at now where they're at. You know, it's really rewarding.
Right.
Yeah, coming out of that cocoon sometimes it's very painful, but I can't do it for them. They
Yeah.
need.
I think it goes really well with that saying, kind of like, if somebody's struggling and they're struggling, you could take them to the water, but you can't force them to drink, right? It's almost the same analogy of the butterfly, helping them out, to helping the caterpillar out. But then when, like you said, when the butterfly is formed and you get to see them fly away, it's like, wow, look at all that hard work that they went through. Look at that battle, it finally paid off. And I think that's the most rewarding thing of what we do, and especially what you do with your patients. I think it's when you've made that impact on somebody's life, and have done what you've done to make a difference in their life. Of course, you can only tell somebody the things that you recommend them that they do, but when you see them take that advice and be able to become a better person, to grow out of that cocoon essentially, and go out into the wild like that, I think that's an um incredible definition to what you do.
And I get very excited when they're excited to come and tell me. You know what I mean? Like you
Yeah.
can tell. Like I had a patient right before I saw you. She was so excited to tell me that she got a job.
Nice.
It has been like really hard for her to do because of her symptoms. And you can hear it and you can see it how just self-esteem was just like rising, right? That confidence starts rising. And those are things that I try to really focus on when I'm working with someone is how can I help their confidence, their
Right.
resilience? How do we help with their integrity? Like these are qualities that I value, and it's so like nice that to see it when they are excited to come and tell me. Obviously, it feels amazing for me.
Right.
It becomes this like dopamine. We're giving each other dopamine.
Yeah. um you said that healing starts with curiosity, not judgment. Can you share a story where a principle transforms someone's journey?
Oof, that's. I was actually thinking of someone today. So when I say about curiosity, is start questioning.
Mhm.
You know, but what if this other thing? Okay? Had a patient that I saw him today. That he was always, he came to me just because he wanted a new psychiatrist. His old psychiatrist just kind of like whatever, and I put that curiosity in his mind. Have you ever challenged your treatment plan? Been on this for 10 years. Don't touch it. Okay. Well, I'm not gonna touch it right now, and like I'm not gonna tell you to stop everything right now. But have you thought about what maybe you might feel? I think we sometimes we do as therapists and psychiatrists, we bubble wrap people to not have feelings, to not have emotions because they're afraid to have them. So I said to him, let's talk about the feeling of pleasure. Have you felt that before? You know what that's like? No. What do you mean? So that concept of feeling pleasure, feeling accomplishment, he had never felt that. But I know in one of his treatment that tends to block that. So I'm like, can we try to maybe lower it a little bit? See what happens. And we did, and there was a really positive change in his life. He started having desire to meet someone. He had been lonely for a long time. Just no desire to, like, whatever. And that's fine. Some people choose that. But I'm like, what if for me, with my curiosity and creativity, I kind of put it in his mind. Never felt pleasure before. Right? If I can say this, but have you had sex before? Can I say this on your podcast? um, you know what that's like. No, never done that. Late 30s, right? Which is not common, I guess, today. Um, but why not? Well, I just never really had a desire to connect with anybody. Always had, my OCD, and I feel that that can get in the way of a relationship. Well, what if it didn't? I'm here, like, just kept probing him. What if it didn't? What if we're able to manage your symptoms that were bothering you a lot 10 years ago, but in a different way, that you can still feel pleasure, you can still feel happiness and joy. I feel this thing that we're doing over here is kind of blocking that. Okay. So put that in his mind, and he came back, and that was one of the things that he was excited to tell me today. Like, I think I know what you mean by pleasure. Crazy.
Love that. Yeah.
For someone to tell you, like, I think now I know what pleasure feels like.
Right.
And it made me excited because I'm like, okay, let's keep going with my plan. He never questioned. He never thought that, again, his symptoms, I'm sure, were very, very bad 10 years ago. But I'm like, dude, you've done now lots of therapy, lots of other treatment modalities. Let's try to tweak this one thing. I think it could be blocking that. So, long story shorter,
Mhm.
that's what happened.
Right.
So I saw that positive change in his life to be able to have this other feeling that many of us feel on a regular basis. Never felt it.
I love that. Yeah, and it always takes the right questions to get into somebody's mind. Like, oh, I never thought of it that way, or whatever recommendations. And um, I feel when you have all of that blocking you out from feeling, like you said, everyday feelings, it's powerful to have him come back and say that there is positive change, that there is a difference being made. So, yeah, I love that you asked those questions, and I love that you helped him. I think it's important to share those kind of stories because I feel like we're always so focused on just what the job is and not celebrating those wins, and I feel like that's a big win.
And being curious,
Yeah.
you know, questioning. I even sometimes myself, I do that with patients that I've seen for maybe over 2 years. I'm like, can we reevaluate? That's what I tell them. Like, let's reassess. You know, let's see what change we can do. You've been doing great. You've been symptom free for over a year. Chances are it's because we've been doing all these things, but we've done a lot of things that I think have kind of rewired your trauma response, your anxiety response to certain triggers. Are a lot more resilient than you were 2 years ago. Now let's try to remove the brakes from these other things. One thing at a time. Not gonna do anything crazy, right? But let's try. So that I'm always thinking,
Right.
right? And we're humans too, right? We can make mistakes. I'm like, I go back. Let me look at the whole thing again. Let me look at all the initial presentation. What has improved? What has not improved? What has kind of stayed the same? How can I challenge what I'm doing? I think coming from world of photography, which is, you're always collaborating with a team of people to come up with a final product. Um, One big issue that I think we're having in mental health is there's no real collaboration with other providers,
Right.
therapists, coaches, primary care. I work, my team works really hard to do, I call them consultation calls, right? Let's collaborate. And you're working with this patient, so am I. Let's team up. We don't have to work in the same, we don't work in the same company,
Right.
but we need to team up because we're working the same final product, right?
Right.
So I've tried to put a lot of those things that I learned when I was a photographer to try to do it in psychiatry. And sometimes is most of the time it pays off. Sometimes I get a really hard no. No, I don't do that. You
Right.
know, actually today I had a patient, and the psychiatrist like, no, don't talk to another psychiatrist.
No, I don't do it.
You know,
Right.
but immediately she's like, I don't want to work with him anymore.
Yeah.
Now she lives in another country, so when I work with patients in other countries, I'm like, we need to have a team that is there with you,
Mm.
and then I'm a consultant psychiatrist, and we collaborate together. There's sometimes I have patients that is like 10 people on the screen,
Yeah.
but sometimes I get a harsh no, and fine, I respect people's mindset and whatever, but I think it keeps the patient from improving.
Right.
So because you can also challenge my thoughts
Yeah.
of whatever I'm going to change.
Yeah.
Like I welcome that. So
Yeah.
I try really hard to do collaborations with a lot of providers. So we're all working towards the same goal.
Right. How do you tailor your approach for high performers who struggle silently with anxiety or burnout?
I that's a tough one, right? A lot of high performers, and I'm sure you've heard the term high functioning depression, high functioning anxiety, and things like that. A lot of those people tend to have past, I don't know if the word is trauma, but past stressors or things or weights put on them that they have to do a certain thing. That's their value, right? You are valuable based on your performance.
Mm-hmm.
They were kind of always taught that, right? Whether it's by a teacher, by their parents, by their sibling, right? So their brain has been trained that I have to function, I have to perform, and the best of my ability, and I have to be the best in my industry, best in this. One of the challenges that I always try to do with them, and I've been able to navigate it pretty well, is how to present the information to them. One of the ways that I do that is your body's telling us something. I had a patient today that she was referred to me by one of my best therapists, Marilena Collazo. I tell her she's my EMDR beast. She's amazing. She referred the patient to me, and the patient was confused why she was sent to a psychiatrist. And I explained to her, you have many symptoms that are telling me that there's burnout. And then eventually, throughout the consultation, she started getting it. It's like, oh, wait, that makes sense. So it's how I present the information, how I teach them. That's your brain talking. That's your nervous system talking. And then the more we dive into it, then she starts telling me, yeah, there was a period there that I started having like numbness in my legs randomly. I was going through a hard time then. So it's a lot of getting the person to understand that this is their body telling us something. We don't have to have severe depression or anxiety, right? Even though they check all the boxes, but in their day-to-day life, they are in survival mode,
Mm-hmm.
performance mode, that they feel that they need to kind of put that aside.
Right.
But then they start losing sleep, they start losing their hair, they start getting rashes everywhere, they miss their period if it's a woman, right? They start having all these other random symptoms, and I'm like, that's your nervous system talking. Most likely it's because of this and this. And then once I explain that to them, they get it. Okay, yeah, that makes sense. You're right. This is all coming from my brain. So it goes back to, I like to educate, I like to teach them, and they're very intelligent, witty, sometimes street smart people, and sometimes they're set in their ways because this has always worked for me. I am not going to deviate from this.
Yeah.
And I tell them, we're not going to deviate. We're going to stay in that path because you feel comfortable there. But the day you retire, the day you lose your job, all these symptoms are going to get worse.
Right.
Because your job is giving you a lot of dopamine. It's numbing a lot of those symptoms.
Yeah.
That change happens, you will believe that symptoms are really going to burst out. And I don't want you to get there.
Absolutely. And growing up, I don't, obviously we didn't know about that burnout. So it was quite the surprise to me when I was older and started this podcast and started doing therapy, what burnout actually looked like. This past August, I completely unplugged from everything. I was so ran into the ground, man. I can't even tell you how badly burned out I was. And I almost didn't come back to podcasting. And I'm really glad I did because, obviously having this conversation being one of them. But before I made the decision to come back, it's like, man, I worked myself so hard into the ground and was recording all this content and posting nonstop and making sure it grows. And, it's just me, which, I'm not ashamed to say that I like doing things on my own and organically growing everything. But it comes to a point where you're scheduling 4 podcasts back to back, and then you realize I'm not getting any sleep, or I haven't prepared enough for this conversation. And you hit that burnout. And a lot of people, especially people that are listening that I do know personally, I know they've experienced burnout on a whole different level too. So definitely think it's important for people to understand what burnout looks like. And like you said, all those symptoms that you think are random have to do with that nervous system, like you said. And I started noticing a lot of those symptoms for myself, whether it was not getting any sleep or just really being stressed every single day at my day job. But yeah, man, I'm a really big believer in self care and just unplugging when you need to unplug, because burnout's not something we talk about nearly enough.
And I think there's many people too that without thinking they're there. When I say by without thinking is like maybe their job is not as crazy or demanding, but they're constantly on social media, constantly seeing visuals that are stressing your brain out.
Yeah.
So even I love social media. I think there's a lot of positive things with it, but I also think there's a lot of negative things that are
Yeah.
coming from it. And what I mean by that adding to someone's burnout is our bandwidth. There's just so much visuals I can see, and the algorithm sometimes goes against you. And I noticed that when I started looking at, I have 7 dogs, so I started looking at posts about dogs, and immediately I started getting posts about dogs that are being rescued in like the most horrific situations.
Mm-hmm.
And it just became more and more like graphic about this poor animal, and I started like crying all the time. I'm like, wait a minute, what's going on here? Like, this is not me. But then I realized that I'm like, wait, I'm noticing that my feed is this super, distressing visual.
Yeah.
And maybe for other people, like, oh, whatever, it's just dogs. Keep swiping. But for me, it was because I have 7 dogs. I love animals, so it was kind of triggering for me without me realizing that it was. And then I started noticing that around the same time, I was like, and I think of burnout. I tell people it's like glitches. I'm started having glitches in. What was, what are we talking about? Where are we? So like little memory concentration issues when I'm in sessions, and I'm like, wait, what's happening here? So then I had to reassess. Be like,
Right.
what am I doing differently?
Yeah, and
Now,
that I'm glad that you brought up the social media thing, man, because that algorithm, like you said, does work against you. And I've kind of learned how to navigate through that algorithm, but sometimes, like you said, you kind of get stuck in that rabbit hole of you saw that one negative video and then here's 20 more to follow
right,
that. Um, so I mean, if I'm ever on social media doom scrolling, sometimes I'll just be like, okay, I don't want to see that again, so I'm not going to like it, not going to watch it more than 5 seconds, and then I'll stop seeing it. Um, Unfortunately, you can't control what other people share and post, and sometimes it just ends up on your feed anyway. But yeah, I think unplugging from that stuff is super important sometimes, because, like you said, social media can be a great thing, or social media can be horrible,
and I
especially
think
especially
we're, we're
lately.
we're overstimulated.
Yeah, yeah,
I have so many people that it's like, I think I have ADHD. I think I have memory issues. I'm like, no, your brain is overstimulated. So that's why when I was talking about burnout, maybe your job is not what's causing burnout, but it's like you're having all these other overstimulation.
mm-hmm.
Our brain was not exposed to these things maybe even 20 years ago, a little bit more, right? We didn't have access to constant anything.
Right.
Now we do. So imagine someone with severe anxiety and panic attacks. They can easily just always be heightened.
Right.
And I've seen it. And I tell my patients, don't watch the news. Don't get on YouTube. Don't watch anything. Give yourself time every single day to not watch anything. Before, we weren't exposed to half of the things that we're being exposed to today. And I get it. Some people like to be informed. They like to know what's happening in the other
Sure.
side of the world. Man, you gotta cut back.
Yeah.
It's keeping us like, on edge.
And one of the biggest things that I've noticed, I don't watch the news at all. I don't watch mainstream media. I can't do it. I remember after I was watching a show, I think it was one of the local channels, and the news follows right after, and I usually shut it off before then. I remember just sitting there for like 2 minutes, 2 minutes exactly. I was so depressed shutting it off. I'm like, this
Yeah.
is horrible. How do you guys watch this stuff?
And unfortunately, is that's how they get
Yeah,
viewers, and that's the formula that works for many of them.
right.
But then it goes to show how I hope we start realizing that these are things that we're demanding of these creators, right? Even the
Hmm.
young people feed us. So who's at fault there? We are
Right.
choosing to watch it too. So if we would watch more of the positive news, right, the encouraging kind of stuff, then I think they're going to start changing
Yeah,
what they're
absolutely.
producing.
Um, how do you help clients reconnect with their values when they feel emotionally lost or overwhelmed? Kind of, I guess, kind of going into that same burnout anxiety conversation, but I guess kind of more so going towards the emotional part of it. How do you break them out of that?
I tend to start with, give me a description of who you are. Because if I start getting the person to realize or start understanding who they are and what they are passionate about, then I go to that. What are you most passionate about? What are things that you really just enjoy doing and you can do it for hours? Then we start going into what, the things that define you, the things that you're passionate about. What do you think are your core values? What is a core value? You know, our magazine is divided every issue by a core value. I mentioned earlier, integrity, resilience, curiosity, humor, right? So I'm always preaching that with my patients. Let's go back to try to define who you are. And it really just naturally shifts into trying to understand, the emotional part, their side of their mind, their body that they were maybe not
Right.
paying attention to. Because their life is so hectic and so much stimulus is happening over here that we're losing and who we are. Many of the high performers that I have, I always try to bring them there as fast as possible because then I can teach them to say no to these things over here because they don't go with my goals and my values.
Right.
So it's almost like, by me bringing them to this, let's focus on this, then they realize, no, wait, that's not that important.
Hmm.
I'm not going to do that.
So essentially, it's almost like reconnecting them to self-loving themselves again. Finding the positives or their passions, like you said, and just kind of reawakening that light in them, if you will.
I think with our lives, as busy as they can be and they can get, we tend to start losing what are we doing this?
Yeah.
You know, who am I? What are my values? And if I start paying attention to my values, then I can choose what I'm going to be part of. You know, me wanting to do more podcasts, more interviews is because one of my things in my core is to educate and to explain. I just love that.
Yeah.
So and bring clarity to certain questions and things that a lot of people maybe might not be thinking about. So then I'm going to do more of that. I'm going to spend time in that projects, right? But
Right.
if there's something that doesn't go with my core values and who defines who Hector is, then I'm not going to do that.
Right.
And when I start getting them to a place where they start a sentence with "I am so and so," and "I am a realtor," "I am a lawyer," I'm like, no, that's what you do. That's not who you are, right? I might have the word doctor before my name now. I didn't have it before. It's just something that I do. I love it. I love doing this. But it's not who Hector is. It's part of who Hector is. Because let's say tomorrow, God forbid, Hector gets a brain tumor. He can function as a psychiatrist. Well, Hector is still Hector. And now he has to shift to doing something else. You see where I'm going with that? So I focus so much and I try to get them to a lane of let's start defining who you are. And my first assignment is I go home and write short description of who you are.
Right.
Right? What's your bio? Don't tell me anything about what you do.
Have you ever seen the movie Anger Management? Jack Nicholson, Adam Sandler.
No, but now I have to.
So there's this, without spoiling like any premise of the movie. There's the part where Jack Nicholson and Adam Sandler first meet each other, and Adam has to go to anger management class, and Jack Nicholson is the counselor, and he's like, don't tell me your job title. Who are you? And he's like trying to get him to admit that he's an angry guy. And Adam's like, well, I like to play tennis. I like to do this. This is like also not about your hobbies. Tell me who you are. So I love that you separate the job title from the person because I feel we're so embedded on being creators, being doctors, being psychologists that people forget that there are people inside of those job titles. And I say that to my therapist all the time. I had a conversation with somebody who, she's like, sometimes people expect you to be on all the time. If you're a doctor, they expect you to talk like a doctor all the time. And
Yeah.
heaven forbid you step outside of that doctor box and have a conversation. Um, and it's so important to be able to step outside of that job title and express who you are as a human being because like you said tomorrow we could wake up with an illness that just kind of ruins everything and you're still Hector, I'm still Chris. So I love that you made that distinction there. I think that's so important.
It defines, it goes back to the whole idea of working on your soul. Like that's why we're here in the first place and why I'm so passionate about working in psychiatry.
Yeah.
Because I am interested in your soul. I'm interested in who you are, what's your core. And if you don't know what that is, well, we got to spend time figuring
Yeah.
that out.
Yeah.
A lot of people haven't spent time doing that.
Yeah.
Many people haven't. Because when I ask a lot of my patients, they're like, I never thought of that. And you're like, well, we got to start thinking about that.
Yeah.
So we can start saying no to some projects that don't go with my core values and who we are. So then we start going towards maybe even helping not having burnout. You're taking on all these things that you think define you,
Right.
but they don't. They're just things that you do, and you think that you have to do them.
Yeah. So your Power Up series Curiosity Guidebook is beautiful introspective. What was the first prompt you wrote and why?
Or curiosity.
Mm-hmm.
So first of all, what I do with the Power Up series, the reason why I created those, and every one is a different one. There is integrity, there's confidence. I start breaking them down, and they're all kind of have the same outline. I break down as what does your brain do when that happens,
Right.
and then I go into, well, what broke that. So looking at confidence, let's look at not confidence but rejection. So let's dissect, where did you lose your confidence and how can we regain it? So, but the main purpose of doing the Power Up series is to get people to start thinking. I have many patients that don't want to go to therapy and they'll tell me these things. I don't believe in therapy. Well, I'm like, oh, that's not a religion. It's not a religion. Like,
Right.
you probably maybe didn't connect with that person, or that modality of therapy was not for you, but it's not a religion. You don't believe it or don't believe
Right.
it. You know what I mean? So, but then I created it for a lot of those people that are like, I don't want to do this. I don't want to go to therapy. I don't want to talk about these things. So that's why I started with a very scientific, objective way of looking at curiosity. And I try to explain it in a way that is easy to read too. Because I don't like to make stuff that is like 300 pages that people are just going to toss aside. So most of them are like 10 pages long, max. And then I always give an exercise for them to do. So, for example, the one on confidence, we're focusing on rejection. So one of the first things that I explain is, think about moments where you have been rejected. You can name 2 of them or 3 of them, write them down, that you felt rejected. And then start going down the path of, what is rejection? What feelings did it generate? And then imagine if those scenarios would have been different. Or better than that, you had the confidence to, even though you were rejected, it didn't touch you emotionally, right? It didn't
Right.
affect you. So I start with always a short prompt of, how does this look like in my brain? And then how can we rewire it?
Right.
So then we can gain that confidence, right? Start working on our integrity, resilience, because I do believe that many of these things could be taught. And I think many of them should be taught. So we don't focus too much on symptomatology. I think there's just a lot of this fixation on just following up on the symptoms of someone and not going into like, well, let's work on your confidence. Because I'm noticing that all your symptoms are pointing me towards you have low confidence.
Right.
Let's work on that, and not so much on, oh my God, your symptoms have not improved or have improved a little bit. I think all of us fall into that trap sometimes because it's
Yeah.
easy. But then I have to remind myself, wait, I'm asking the same question. Go back to what
Mhm.
I do, right? And to me, it's very valuable.
So I usually ask all my guests this question and try to rephrase it for every guest that I have. If you could change anything within your profession or just the mental health field in general, what would it be?
Oh my God, that's a big one. One thing, well, I think we've touched base on a few of them. One is the concept of collaboration, like true collaboration. And then ultimately, I think by having true collaboration with other providers, your knowledge bank as a provider is going to grow.
Yeah.
But it would naturally improve what we know, what each of us know, right? That just because we graduate doesn't mean we stop learning. So by doing that, we're kind of sharpening each other, you know? And I think that's something that definitely needs to change because I think it would lead to better care and it would lead to just naturally into us providers educating our patients so they can be
Yeah.
smart, smart people.
Mm,
Right? So they know what's going on in their body, what's going on in their brain,
yeah.
so then they know what to do. And then that's just going to feed back into compliance. It's going to feed back into trusting your
Right.
provider. So I think that is one of the major things that I would change.
Yeah. I
Hard to
completely agree. I think one of the biggest things that I've noticed is lack of collaboration when it comes to creators. And sometimes it's like, somebody doesn't have enough followers, somebody doesn't have enough likes or whatever it is. And it's like, at the end of the day, we're all doing something to try and make a difference in this community. It shouldn't matter if I have one follower or a million followers. I'm making the effort to make a difference and to make a change. And I've had conversations with those people, if they ever say, oh, well, you don't have enough followers and I can't be on there or something like that. It's like, okay, man, like, whatever. Like, this is why society is where it's at right now. Cause like
Yeah.
you said, lack of collaboration. Um,
I
before
hate
we,
that, by the way.
yeah, me too.
Like I find that so first of all disrespectful to what someone is doing with their
Yeah.
time and they're trying to add, especially something like in mental health. But then two is like, well, that's the whole point of collaboration.
Right.
So then your listeners can be listening to our content together and ultimately help people. Because maybe, the listeners in the other, even though that person has many, they're not getting much from it. They're just kind of listening it because it's a popular one or it's a famous one.
Yeah.
But then they'll listen to another one, they're like, oh wait, that clicked for me. So my
Yeah,
view.
and some of those big creators, I'll listen to some of their interviews if they have like a similar guest, and if I happen to take notes from those interviews, it's just like, wow, why are we getting basic questions from these creators that are as big as they say they are? And I just feel like once you start getting really big in your head, then that passion for what we're doing goes away. It's just kind of like, oh well, people are going to listen no matter what, so I'm just going to put out content to put it out. That's how it feels.
And it goes back to what we talked about at the beginning, right? Is the misfits. I don't care if it's 10 misfits listening to me right now. I'd rather have that than 200,000 commenters. I
Right.
hate saying that. Like people that might be viewing us misfits as like, oh, whatever, you're weird. And I don't want to listen to you. I I want to get to those
Yeah.
10 because those are the ones that to me matter.
I would rather that one person who needs the interview listen than 100,000 paid listeners to just listen to content I'm creating. Um, before we get to the quote that I close my podcast out with, where can our listeners find you on social media?
Well, social media is pretty easy. It's the word doctor spelled out underscore Hector. YouTube, my Instagram. I post a lot on Instagram. That way it's pretty easy.
Perfect. Um, before I read my quote, did you have any closing words you wanted to share with the listeners? If not, no pressure.
I would say that your brain is your most valuable organ. Take care of it. Learn as much as you can from it, and what you can add to it and remove that you're putting into it right now, because you can't get a transplant.
Yeah. Absolutely.
You only got one.
So today's quote that I have is from Mr. Matt Haig, and it reads, mental health problems don't define who you are. They are something you experience. You walk in the rain and you feel the rain, but most importantly, you are not the rain. And, I feel like that's a pretty commonly shared quote, but I also feel that people maybe not fully understand the meaning behind it. And I feel so many of us that are diagnosed or undiagnosed, just kind of assume that's their personality. That's how they have to live. And like you said, the brain is the most important organ. We got to take care of it. So, to my listeners who are diagnosed with something or are struggling with something, that does not define who you are as a person. And everything that you're battling right now, it's a rough season. It's not a bad life. It's just, you're going through a rough season. You will get through it. Hector, thank you so much for coming on here. You've been a great guest. I feel like this conversation was very powerful. But thank
Really
you
good
again for your
questions, by the
time.
way.
Thank you, man. I
Love
appreciate that. For all my listeners, thank you as always for your support. Until next time, be gentle with yourselves and much love.